pain postpartum. So we talked about already how with a vaginal delivery, how you may have vaginal pain, and we talked about for a C-section how you may have that incision pain. But then there's also another kind of pain that you're experiencing. We talked about it a little bit in your uterus postpartum, but I just want to tone in on a couple things with you. So your uterus postpartum is contracting back down, and you may have a lot of cramping with this. So especially moms who had babies really close in age, because your uterus just got done working, it's like a sore muscle that you're putting to work again. And also moms who have babies really close in age and have multiple kids, you can have a lot of that cramping and pain postpartum. So after you have your delivery, most places give you Pitocin after delivery. This is something that you're of course allowed to refuse, but they may end up giving you a little bit more if you had a lot of bleeding. And this can cause a lot of cramping because it's making your uterus contract, controlling your bleeding and clotting, and this can make those cramps a lot worse. So here are some things that we can do. Your uterus, like I've said over and over again, is right next to your bladder. By the end of this, you're gonna know, if nothing else, your uterus is right next to your bladder. So going pee often is really, really helpful. And I always suggest, like before feeding baby or something like that, to keep it in your mind of going pee often, even if you don't feel like you have to pee. Because remember, you may not have that urge to pee, but then you sit down on that toilet and you feel it. So you want to make sure you're going pee often. Another thing you can do is a heating pad. So just like some women during their menstrual cycles, they have a lot of that cramping, and a heating pad can feel really soothing. A heating pad can feel really soothing during those postpartum cramps. A lot of hospitals have a disposable, like a one-time use instant heat pack, kind of like the hot packs that you have for your hands when it's cold. They have those you can use, but a heating pad you can also use. I've worked at some hospitals that are really weird about bringing in those to use while in the hospital. They say that it's like they don't know if it's safe to use in the hospital outlets, but I think like if we're using phone chargers, why couldn't you use that? So a heating pad. Some women though, they don't like a heating pad, it doesn't feel good to them, and they prefer ice pads over that. So you can also do that as well if you prefer using a ice pad. Now, if you had excessive bleeding and they had to give you more medication to help with that bleeding, then like Cytotec or something like that, or Methogen, then you may end up having more cramping than somebody else. And also whenever you breastfeed, it releases nature's natural version of Pitocin, oxytocin, and that can also cause your cramping to be more intense. That's like nature's way though of helping take care of you and helping control your bleeding and clotting postpartum, but it will cause more cramping, and that's a normal thing. Sounds kind of bad. It's almost like, great, I know that I'm breastfeeding correctly, or else I wouldn't be having this cramping. So maybe that's like a silver lining you can look at. I'm gonna go into just explaining a little bit more about the medications that you may have. So we can either have scheduled medicine. For instance, you may have Motrin, like an 800 milligram ibuprofen that is scheduled every 8 hours, so 3 times a day. You may also have like I don't know, a 500 milligram Tylenol that you get every like 6 hours or something like that, that is scheduled a certain way, and they try to make it so you have something kind of around the clock. You may also have a doctor who only writes like an as needed medicine, and it's something that's you have to ask for, or a nurse can offer it. Depending on your nurse and like the hospital and the doctor will depend on what this looks like. But you can always have a conversation with your nurse at the beginning of their shift, being like, what kind of medicines do I have scheduled? What does that look like? You can also ask your doctor if you have a vaginal delivery, like while they're suturing you up, if you have any tears, or before they leave your delivery room, ask them what they're gonna have scheduled for you or what they're gonna have available. Also ask them before your C-section, if you have a C-section, what kind of things am I gonna have available for me? typically with the C-section, they do give you stronger pain medicine because it is a major abdominal surgery. So they're going to give you stronger pain medications. And I bring this up because sometimes I come in, or another nurse comes in and they say, hey, how are you doing? You're like, oh, I feel great, or I feel fine. And we're like, oh, okay. And then we're like, we checked on you, bye. But you're really hurting and you haven't had anything for a while, but you think, I just thought I would hurt. I just had a baby. There's different things you can do. But going pee is one of the best things you can do to help with your uterus postpartum, and a heat pack or an ice pack can be really beneficial. Motrin is really helpful. A lot of places really suggest using a Motrin ibuprofen over Tylenol because it also has that anti-inflammatory. So that can help whether you have a vaginal delivery and you're really swollen down there from that, or if you had a C-section and your incision is hurting as well. So it has the pain option and then also the anti-inflammatory. So it gives you a little bit of both for that. I know some people like really hate taking pain medicine. I get that. But if it's interfering with you getting up and moving, which is what you need to do for recovery, or if it is interfering with you being able to take care of yourself or baby, then you want to be on top of your pain medicine and your pain management. If you wait until your pain gets to such a high level, now we're like chasing that pain. And so even if you have to set a schedule on your phone, I'm going to take Motrin every 8 hours, regardless, then you can have that for you and kind of slowly come back, taper off of that pain medicine. Or if you need to remind yourself every single time I feed my baby, before I feed, I'm going to go pee. And that's a good reminder to yourself to help you with that pain medicine. I just don't want you to be in the mindset of, I just had a baby, Jessica, I'm going to hurt, I don't need to take anything. I mean, you're going to be uncomfortable, yes, but there's no reason that you should be hurting and unable to take care of yourself or your baby. And I just really want to hone that to you, that you shouldn't hesitate to ask for extra if you feel like you need it.